happily.
It goes down and it goes up. She said, I don't know what's going on with this food.
She's hoping it goes way
I
down.
can wait.
Because my granddaughter gets stuck.
I can wait.
Yeah. Don't you feel guilty?
I'm Tamara. I'm your town nurse, for those of you who don't know. Thanks for coming. We're going to talk about the golden years, urinary health today. The reason I call it that is years ago when I was a nursing student, I was taking care of a gentleman and he had a catheter with a urinary drainage bag, and he would tell me all the time that these were his golden years, and he would always point to his bag. So it always stuck with me. So I think to begin, we'll first start with just a general overview of the urinary system, just so we can kind of talk about, you have to kind of know about it a little bit before you kind of go into what kind of problems you could have. So we have, it's made up of different organs, as you can see. It basically, the job of the urinary system is to store the urine and then get rid of the urine out of your body. It's made of the kidneys, which you can see those lovely bean-shaped organs. They're actually up in your, on your flank or on your back. They actually help filter your body when you have blood and fluids. It filters through. So medication and waste that we have and that we have as just part of a normal process of digestion and things that we take in need to have a way of getting out. And one of the organ systems in our body that helps with that is the kidneys. The kidneys actually filter out a lot of wastes. So those are those bean-shaped organs. And then from the kidneys, there's these two long tubes, and those are called ureters. And that's just a way for the fluid, or what will be urine, to come down, or what is urine, to come down those tubes and to get to the bladder, which is basically like a little balloon-shaped organ in your lower abdomen. The purpose of the bladder really is just to store the urine, and then eventually the urine will be excreted and emptied through the tube called the urethra, and then exit the body that way. And that's what happens when you urinate. The kidneys are about fist size, so in case you were curious about how big they are. They balance a lot of the chemicals and hormones, and they help control blood pressure, actually. Did you know that? There's a relationship between your kidneys and their function and blood pressure, and part of the reason for that is some of the chemicals and hormones that they're helping to filter and negotiate in your body can actually adjust sodium levels, and they can adjust your blood pressure. So sometimes if you're having high blood pressure issues, your doctor is going to look at your kidney function as well. All right, so fun facts about the urinary system. A human bladder, which is the balloon that your body holds the urine in, can stretch and hold about 400 milliliters of urine, right? That's about half a liter almost. That's quite a bit. That can expand quite a bit. All the blood in your body is actually filtered through the kidneys 400 times a day. So it's quite a busy process there. The kidneys can clean more than 1 million gallons of water in a lifetime, which is more than enough to fill a small lake, actually. We'll talk about some of those other things. It talks about stress incontinence. We're going to talk about urine is actually a byproduct or a waste product of the blood, and it's non-toxic. It should be sterile. It's made of mostly water, a little tiny bit of urea, and some mixed minerals and salts and some enzymes that your body doesn't need, so it decides I'm going to get rid of that. If one kidney fails to function and it's removed, the other kidney can increase in size by 50% within 2 months to be able to handle its extra work that it has. So kind of interesting. My little cartoon there says, "You're in my thoughts." So I want to talk about one of the most common issues that people have when we're discussing urinary tracts, and that is a urinary tract infection, or UTI is what you might hear it known as. It can be very common and it can be very annoying. Some people are just prone to them. Sometimes medications can contribute to your risk of getting an infection. There's a lot of reasons that we'll go into, but basically what it is, urinary tract infection or UTI, is when bacteria and germs get into your urine and they travel up into your bladder. So we talked about the urethra as a small little tube that exits out the body. Then you've got your bladder. Remember the picture with the big long tubes, those ureters? And then what's at the top of the ureters? The kidneys, right? So when we're talking about a UTI, that urinary tract infection could be anywhere in the urinary tract. It could be low, it could be in the bladder, it could be creeping up those ureters, and it could ultimately get to the kidneys. Normal urine is sterile, meaning it has no germs or bacteria in it. It's clean, it's very clean. And there's basically, it kind of goes out one way. It doesn't typically go back up. So it's almost like a one-way valve. It goes out and that's it. Nothing should be coming back. But bacteria can still get into the urine from the urethra. So that's just what that's showing you. Here's some common causes of UTIs. That little picture up there is actually a microscopic E. coli, which is a common bacteria in stool, in feces. So what I see is if you're not drinking enough water and fluids, you can get dehydrated. And the problem is as we age, we lose our sensation for thirst. So you may not recognize that you're thirsty, but you are. And if you are thirsty, you're already dehydrated. Some of the ways you can tell you're dehydrated is your mouth dry? Are your lips dry? Are your eyes dry? Have you not urinated or voided in quite a few hours? When you do urine, is your urine very, very dark? Is it strong odor? Those can be signs that you're dehydrated and you haven't had enough to drink. Your urine should be kind of straw colored. We'll get into that later too. The other problem with being dehydrated is that's very irritating to your bladder. So that concentrated urine is not diluted with water, so there's a lot of irritants. Think about it, it's waste. Our body wants to get rid of it. The longer it sits in your bladder, the more chance that you can get an infection from some bacteria. Holding your pee. Don't hold your pee. The minute you feel the urge to go and empty your bladder. We're famous for that, Sometimes you just get comfortable and you feel like you just went because you took your morning diuretic or your water pill, which makes you have to pee more often. Or, gee whiz, the bathroom's all the way upstairs. Or I'm out shopping and it's way down the hall. Whatever it is, try not to hold your pee. And if you know that you're going to be in a situation where a bathroom may not be, empty your bladder regularly. Every time you pass the bathroom and you think, just go ahead and go. It's better to empty that bladder because that way you're keeping the muscle wall of your bladder stronger. It starts to weaken when you don't listen to those body signals that you need to empty that bladder, and the weakened bladder wall, we'll see in a little bit, actually can lead to some urinary incontinence or dribbling from overflow and a weakened bladder muscle. So you want to train that muscle and continue to use it. You know what they say, if you don't use it, you lose it. Kidney stones, those are, sometimes they're made of calcium, different things that can cause some blockages, can get the urine to get backed up, and we know if urine stays sitting in there too long, it's more risk of developing infection. Sex, if you have sex, go pee right after. That's a good tip. Some birth control measures, some feminine products. Anatomy, I think we're all women here today, but there's a short distance, for us from the outside of our bodies to the skin where there's germs naturally occurring to the inside of our bodies. Just anatomy. So women tend to get more infections than men. Diabetes is a condition where your blood sugar levels need some monitoring, and they can be either too high and too low, and that can cause and make you at risk for more infection. The other thing, the first one I skipped over, I didn't mean to, improper hygiene. So basically, there's one way we should be wiping ourselves after using the toilet. Always wipe front to back. Don't go back and forth. Why? Infection, right? I mean, the other area that's back there is our rectum, and that's where we excrete stool, and stool is dirty and there's germs. So we don't want to be bringing anything from the back to the front. So only wipe front to back. So, did anyone know that there's actually a link between being constipated and having urinary tract infections? There is. And it's actually just a physical reason. What happens is, the more stool you have in your abdomen and your colon, and if you've not been able to go in a long time, it can actually, you feel bloated sometimes and distended if you're constipated. Well, it's actually distended in there as well, so it's shifting things around in there. It could be pressing on the bladder wall. It could be causing some obstruction. It could be causing the urine flow to backflow a little bit, and you could have more concentration of the E. coli, which is a germ that we see in stool. So it's important. There's a link there, hand in hand. If you tend to be constipated, it's going to be doing dual duty if you can make sure you try to maintain and manage that and prevent that constipation. Not only will you be having regular elimination, which is healthier for your bowels, but you could also be preventing urinary tract infections. All right, so what are the symptoms of urinary tract infection? Let me just start by saying very often in people that are over 65, symptoms may present differently. So the main hallmark symptoms is that you could have pain with urination, burning. You could have urgency, meaning that when you have to go, oh my gosh, I have to go now. Or frequency, meaning that, wow, I'm in the bathroom every 2 seconds. I feel like I can't empty my bladder. Those are kind of hallmark lower abdominal pressure or pain, hallmark signs of a urinary tract infection. Not everybody gets that, and as we get older, sometimes infections present themselves differently and the symptoms look different. Sometimes it's just you're more tired. Sometimes you might have a low-grade fever or a higher fever. Sometimes you only notice that your urine is really cloudy or really smells really strongly and kind of foul, not just strong, but has a little foul odor to it. Or you're actually having some more accidents and you're finding that you're not able to control your urine stream, maybe not able to get to the bathroom like you normally could. So those are, sometimes you just, maybe you're feeling off and you can't put a finger on it. You know, it's a common thing for a doctor or healthcare provider to maybe rule out, is it a urinary tract infection? Because sometimes those symptoms aren't as in our face or as blatant as we'd like. I think we covered that. Any questions so far? Okay. All right, so how do you diagnose a urinary tract infection, or how does your healthcare provider? Typically, you know, if you're worried about it, or you know you have a tendency toward them and you've had them in the past, or you have any of those symptoms that we just discussed, talk to your healthcare provider. A lot of times they will want to get a urine sample and they will want to test it and they will want to look for germs in it. And they will want to do that because they want to see which particular germs may be growing in your urine so they can, you know, prescribe to you the appropriate antibiotic that will be effective in treating that. So that's why they get the urine sample. Basically what it is you do pee in a cup and then they analyze it at the lab. They're going to look for things like red blood cells, white blood cells, which are our fighter cells. They fight infection. Remember what we said, our urine is sterile, so there shouldn't be any of that stuff in there. If there is, chances are you could have an infection which would need to be treated. Obviously, if you see blood in your urine at any time, you should definitely call your provider right away. Epithelial cells, in case anyone was wondering, are just skin cells. That's a fancy word for that. So I thought we'd just take a minute and talk about how to actually collect the specimen, because that's really important. And you don't want to get, you know, we said the urine is sterile, and we really want to get a good picture of what's going on. So there really is a right and a wrong way to do it. The most important thing is you always wash your hands before doing anything. Usually they'll give you those wipes, and they say there are 3 wipes, and they say wipe 3 times and pee in the cup. What we actually want, ideally, is wash your hands, Wipe 3 times. And which direction are we going to wipe? Front to back. Yes, front to back, always. And you're going to wipe 3 times with those wipes. And then you're going to pee in the toilet a little bit and stop, if you can. If you can. And then you pee in the cup. That's called a midstream clean catch urine sample. Ideally, that's the best way to collect your urine. Now, if you're worried, once I start, I am not stopping, just pee in the cup. But ideally, any idea why? The stream of urine will actually force some of those like skin cells and outside germs out. So it's actually testing the urine and not just things that might be on your skin. So that's why, ideally. And that's it. And they don't need a lot. You don't need to fill the whole cup right up. Questions on that? Okay. So treatment, usually it's pretty simple. Sometimes they'll start you on what they call a broad spectrum antibiotic. All that means is it covers tons of different germs. And it's usually just a few days, 3 to 5 days for most regular urinary tract infections. And usually you get relief right away. If you were having symptoms, you'll usually sense that after the first day or 2 antibiotics, you'll be feeling pretty much back to normal. It's important in general to maintain good hydration, drinking plenty of fluids and water throughout the day. But especially when you have a urinary tract infection, you want that bladder and that system really flushing out. Also, if you're on antibiotics, typically you should increase your fluid intake to help the kidneys, because what's part of their job? To filter through, and they also filter medications and drugs. And when we take medications, there's parts of that medication that is good for our body that is helping to deal with whatever we need it to deal with, but there's also waste products that need to be excreted as well. So drink extra water. Okay. Treatment. Sometimes in postmenopausal women, a doctor may prescribe an ointment because you may get some vaginal pain along with that as well. So you can talk to your doctor about that. All right, after treatment, you typically don't need to submit another urine specimen. If you did, however, you could not do that until at least 2 days or 48 hours after your last antibiotic dose. Any idea why? You might not find anything there because of the antibiotics that are in your system. That's exactly right. If you're still having symptoms, of course, call your doctor. Some people get recurring urinary tract infections or kind of chronic, like it seems like you just get one and then now you get another one, you get another one. There could be lots of reasons for that. Sometimes there's a kink in the ureter. Sometimes it's just anatomy, the way your body is inside. Just like we have different hair color, eye color, body shape, your body can be shaped differently inside, which could make you more at risk, for an infection. So you may need further testing if you tend to get them more often. Okay, so we kind of talked about this already, but I like the visual. Always wipe from front to back. Don't hold your pee, go right away. Drink lots of water. Baths aren't a great thing. Just the stagnant water kind of has the opportunity to get in there. Showers are typically better. Steer clear of any feminine products. The reason why is that can actually change the pH or the acid-base balance of your female parts. And you really need it to be in balance to prevent an overinfection. Unless your doctor has prescribed that for you, I would be cautious with what you're using for hygiene products. And be discriminating with your antibiotics. Make sure that you're taking exactly what the doctor prescribed, the dose, the frequency, and for how long. And if he told you to take it for a week, take it for a week. Don't stop when you feel better. That's a problem, and it can actually make the germs change, and then they become smart germs, and then the regular antibiotics we have may not work. Or you could run the risk of having recurring infections because now they're getting smart. Okay, so another reason not to make sure you empty your bladder right away when you get the urge is because you're going to have a higher risk of developing the urinary tract infection like we talked about. Part of the reason I discussed a few minutes ago was it actually can weaken your bladder. Your bladder is a big muscle, really. And so when you don't listen to those signals or you ignore it or you're like, oh, I'm training my bladder to be like big, hold a lot like a camel. You don't need to do that. Empty it. It's actually going to be stronger. Your muscles will become stronger by emptying on a regular basis. So let's talk about incontinence, which basically means when you have a hard time being in control of when you urinate, There's a couple different kinds, and there's a couple of different reasons for it. There's overflow incontinence, which basically happens, there could be an obstruction somewhere, or maybe you're not emptying regularly enough, and so the bladder becomes so full that it's just going to leak. It has no other choice but to leak out. So that's overflow incontinence. So some of that can be prevented by good hygiene habits by going to the bathroom. Stress incontinence is when the pelvic floor, for those of us women who have had children, our pelvic floor muscles, and we'll talk about this a little bit later, can actually become weakened just because of the stretching in the process of childbirth and being pregnant and the stress on the body. So the pelvic floor muscles might be weakened, and that can actually cause when you laugh or you sneeze or you cough and then you might dribble a little bit out. That's called stress incontinence. So, and we'll talk about the exercises. There's something that you can do. We'll talk about the exercises you can do to strengthen that pelvic floor so that you don't have that. Urge incontinence can be from an oversensitivity of the bladder. It can be from irritating substances like caffeine, being dehydrated, having really concentrated urine. It can also be from the nerves that are talking to the bladder. Maybe it could be medication-wise. It could be caused by a disease process that's giving mixed signals to your bladder on a nerve level. And so that could cause some urge incontinence where you're going to the bathroom, but then all of a sudden, you feel like you have to go again. So it's always worth a conversation with your healthcare provider if you're having any kinds of issues around this, because it's not a normal process of aging. Right? Did you hear me? It's not a normal, you do not, just because we're older women does not mean we have to, wet ourselves. If there's a problem, let's talk about it and let's see what we can do about it to either correct it, get to the root cause of it, or maybe learn how to deal with it. I like my little cartoon there. He says, with age comes new skills. You can laugh, cough, sneeze, and pee all at the same time. I do want to mention here, it's not a physiological incontinence, but keep in mind, anybody who may have memory issues or some cognitive issues where they're maybe not processing things right, they may have some incontinence issues because we call that functional incontinence, meaning maybe they couldn't find the bathroom. Right? So if you have a loved one or a friend or a caregiver to somebody that has a memory issue or maybe has some dementia or something like that, keep that in mind, especially if they're in a new environment. Maybe they're having an accident because they couldn't remember where the bathroom was. Maybe they forgot that they haven't been in 3 hours and they just, drank 3 glasses of water, and maybe they need that prompt or cue. Also with persons with dementia or some forgetfulness, sometimes a functional piece, or even for any of us, we're all dressed up for the day, but darn it if we can't get those 5 those buttons undone. So snaps in Velcro can make it easier to actually be able to get to the bathroom quickly if you need to. So be aware and mindful of what you're actually wearing. If you're having an issue, make sure it's easy peasy so you can get, when you're in the bathroom, you can get your pants down and go, do business. There's actually a mnemonic called DRIP, D-R-I-P, for causes of incontinence. The D could be delirium, which some people that have dementia or some mental status changes could be experiencing, and they're just not aware. They're losing kind of awareness and control. Drugs, so some of your prescription drugs, if you're noticing an issue, you might want to talk to your doctor and or pharmacist about what could be causing this. If there's a medication, some medications do cause urinary retention, meaning you're holding on to that urine, and then we know that can increase your risk for developing infection. So have that conversation. The R is for restricted mobility, What if you are really suffering and it's really hard for you to get up and out of that chair and into the bathroom? You know, that could prevent you from being able to get to the bathroom often enough and timely enough. So there are things that you could do by, you know, perhaps making sure every time you get up, you just visit the bathroom, whether you feel you have to go or not, and just empty your bladder. Try to keep it as empty as possible. If you're getting up at night to pee, whatever your bedtime is, at least 2 or 3 hours before that, don't have any drinks. You know, avoid caffeine and things that can irritate your bladder or make you have to pee. Take your diuretic medication in the morning so that it's not keeping you up all night peeing. The I could be for infection, inflammation, impaction or of stool, which is constipation, we talked about. Pharmaceuticals, and polyuria is just a fancy word for saying having to go to the bathroom a lot. There was actually a study in Scotland that showed a link between incontinence and falls. So, you know, just be aware of that too. And I like this cartoon says, I called the incontinence hotline. They asked, can you hold, please? All right, so we talked about some of this already. Avoid drinking large amounts before bed. Limit your caffeine, alcohol. Some sodas can have caffeine, and that's why it can trigger some bladder irritation. We'll talk about pelvic floor exercises. Basically, it's tightening your pelvic muscles before coughing, sneezing, or lifting. You could do that. No one knows you're doing them. You can just do them anytime. You could be watching television. You could be knitting or crocheting. And you could be doing them. And you're like, well, what are you doing? So basically, the muscle group that we're targeting for our pelvic floor exercises is if you were going to the bathroom and voiding, you're urinating, and then you were to stop your stream of urine. That's the clench of muscle group that we're talking about. You know how that feels? That's how you know you have the right muscles, your pelvic floor muscles. So it's not a good habit to do that, but if you're trying to figure out which muscles am I clenching, that's how you can figure that out, and you'll know how that feels. And then you can do it, you just clench and hold, and you can do it as many times as you're sitting here, and that will actually strengthen those muscles and hopefully, you know, strengthen that pelvic floor. Empty your bladder frequently and completely. Try bladder training. We talked about that, visiting the bathroom, even if you feel like you don't have to go. Healthy weight and staying adequately hydrated. Oh, this was for toileting tips for those with anyone who has some dementia or some forgetfulness. Remove the obstacles. One of the obstacles could be clothing, or it could be, you know, not knowing where the bathroom is. All right, there's lots of products out there to cope with it. There's things that you can protect your linens, your bed linens, your bedding. There's things that you can wear, panty liners, briefs. They've come a long way with some of those products. They're very discreet. They're very much more comfortable. They can absorb a lot. So check that out or talk to your doctor if you need help with that. Those things on the side there, the Travel John, they actually do have urinals for travel, for people that are, you know, you have to be careful and you have to make sure you have privacy. We don't want any exposures happening here, but they do exist, and then there's urinals for at home. I find that some people, and there's actually female urinals, that's a male urinal. Some people will also get a bedside commode. If your bathroom is far from your bedroom at night and you're finding that you're getting up, it's a safety thing. Just if the toilet's over here, then you can just get up, go pee, go back to bed, and you're going to have a less risk of fall, less risk of accident. So consider that. But some gentlemen like to use some urinals. The female urinals are a little trickier. Most women I know prefer to use a bedside commode if they have to get up at night. It feels more natural. We did talk about the link between constipation and urinary incontinence. Straining can weaken the pelvic floor muscles, so that's another reason not to be constipated, and can cause the stress incontinence. The full bladder can press against your full bowel, can press against your bladder and can make you feel the urge to urinate. And then it can also block the flow of urine if things are swollen up in there. I like this guy. This is our pelvic floor exercises. It looks like they're at the disco, but that's actually, it's actually your your uterus, your bladder, and then you can see the colon in the background. I know. It's actually an interesting website, the Active Life Rehab. They're out of California, but they have a lot of tips if you're interested, and it should be in your handout to check out on dealing with incontinence and strategies. So it was kind of interesting if you're someone who likes more information. And there's no men here, so I think we could probably skip over this. But so a cause of some issues for men is their prostate gland actually can get enlarged and can cause some issues. So as women, are you okay skipping over this, or and need any information for the men in your lives? All right, we'll skip over that. All right, so urinary health, overall health, right? All these things that we talked about are really important. You know, and there are other, I wanted to show you this. This is just a scale, just a range of the color of your urine, what your goal is, right? So if you can see that middle gold right there, it's telling you, look, you need to drink more. If your urine is completely clear, you're probably overdoing it, or at least you might be drinking too much in a short period of time. It doesn't need to be completely clear, like you can't see any color. Straw colored is a good range. That's a good color to keep in mind. And when you turn around, look down in the toilet. People sometimes say, like, I don't know what color my urine is. Well, when you turn around to flush, take a look and see what it looks like. It's not a bad habit to get into. Oh, people ask about cranberries all the time. So I can tell you that there's no medical science that says cranberries can effectively treat a urinary tract infection and cure it. However, there have been plenty of studies that show that one of the ingredients or chemicals that are naturally found in a cranberry can actually prevent bacteria from sticking to the bladder wall in the urinary tract. So it's not going to hurt if you like the cranberry juice. You do want to watch the sugars though, because sugars have a way of making things attach and stick. So cranberries are not a bad thing, and they have other health benefits too. They're full of vitamin C, they're good fiber, so they have anti-inflammatory properties, they keep the digestive health healthy, the digestive tract. So that's kind of the skinny on cranberries. It's not meant to replace an antibiotic if you need it and you have an infection. It won't cure your urinary tract infection according to science. So I think that's what I have. Any questions?
Yeah. It's not a question, but I have a few tips.
Okay, I'd love to hear it.
Because I've had UTIs since I was 4.
Okay.
My first cystoscopy was at 4 years old.
Mm-hmm.
So a doctor said to me, a young doctor, maybe when I was in my 70s or maybe 75, he said, you get to feel your own bladder. And he said, you'll get used to it so that you think you're finished, but you're really not.
Yeah.
So he said, if you're not sure, stand up for a few minutes and then sit down again.
Great.
And he said, you'll find out, because as you get older, your bladder is filled with rugae, that
Little like bumps and
bumps
curves.
on the inside.
Yep.
And so he said, the urine gets tracked.
Mm-hmm.
So he said, you may think you're finished, but he said, you'll get to know, you'll feel your own bladder. And it's true, you really do. If you get tuned into it,
Yes.
you really do learn that.
That's a good point.
Because I still have urinary tract infection, but I'm prone to tumors.
Okay.
So,
Thank you for that. That's a great tip. I used to tell my postpartum women, because everything's all messed up after having a baby. Things are swollen and all the organs are kind of finding their place again in life. In terms of getting to know your body, that's a great tip. But the other thing you can do is actually, if you're sitting, it's going to get a little graphic here. If you're sitting like this and you're on the toilet and you've emptied your bladder and you think you're done,
you could try your tip of, okay, am I really done? Like, you're gonna stand up again and see, because sometimes you'll feel that urge again. You can sit. The other thing you can do is lean forward a little bit. Why?
It pushes it out.
It can push it. Now don't go lean it so far you fall over. And it'd be good if you had a handrail or something to grab onto, but just lean forward a little bit because your lower abdomen will come in contact with your legs and you can almost squeeze it a little bit. So that, the other thing is some people had a hard time starting their stream of urine. I don't know if that's, you feel like you have to go, all of a sudden you sit down and then,
No, nothing.
what's that? Nothing's happening. So some women would go in the bathroom, flick the faucet on,
Yeah, I've heard about
and the noise of the running water
Yeah. Do that
could
with
stimulate,
kids.
oh yeah, I need to
Yeah.
pee now. Another thing is peppermint. The smell of peppermint can make you have to pee.
Oh.
Or just take a couple of real deep breaths
Yes.
and relax.
Try to relax, exactly. My kids used to play pranks and, or they would tell me about kids playing pranks where they would dip someone's hand in warm water. So I don't know if that works or not, but.
Oh, yeah, it does.
Yeah, that's okay, there you go. There's another tip. Yeah. Any other questions or comments? No? Well, thank you all. Thank you. Yeah, some of the antibiotics, I mean, I know some people that have, are prone to kidney stones. Some of those kidney stones stay in the kidney, and we just looked at the outside of the kidney. Our pictures didn't show, but the inside of the kidney is kind of an interesting organ, and if you were to slice it and then look at the cross section of it, there's all kinds of little spots in there for little spaces, kind of like your rugae that you were talking about, little nooks and crannies where stones can actually get caught and sit. And a lot of times they will, depending on your health status and your age, they may say, oh, we're just going to leave that kidney stone there. And some people have been on antibiotics to prevent the UTIs, urinary tract infections, from that. But that's a problem that some people have. Again, a good reason to always stay well hydrated because some kidney stones are made from calcium. So if you're not drinking enough water, that can contribute to developing a kidney stone. So you don't want that either.
I have a
Yeah.
question. Today is my last day on the antibiotics.
Yeah.
When should I then check to see if the infection is gone?
Yeah, so typically they don't test the urine again once you've been treated. But did you have symptoms?
Yeah.
Okay, so I would just mostly listen to your body and see if you develop any symptoms again. And then if you feel like something's not quite right back to normal, then I would give your doctor a call, for sure.
Another thing I do if I feel like I may be starting to get another infection, I'll test my own urine. I make sure I have a glass that's just come out of the dishwasher so I know it's really sterile.
Yeah.
And I'll test my own urine, take a look at it and see what the color is, and then
Yeah.
I'll smell it to see if there's an odor.
Yeah.
So sometimes you can do that just to help yourself.
Now, with all your experience here with do you notice those things that we talked about, like the change in color and odor when you have an infection? Mm-hmm. You do. Okay.
Mm-hmm. But lots of times, because I always have blood in my urine, but it doesn't show until the microscopic comes back.
Right.
But so I don't like to wait. So I always test my own to see what it looks like.
Yeah.
I used to get urinary UTIs when I was traveling
Oh.
because I wasn't drinking enough.
Oh, yeah.
I was running around in hot climates anyway. I got some test strips that I could test myself. And then my doctor also gave me some of those cups you showed that were sanitary cups.
Yes.
Yeah. She also gave me a couple of those. She says, okay. And then she gave me a course of antibiotics.
Yeah.
We were very proactive about this because it can ruin a trip.
Oh, yeah.
And she trusted me to not be stupid. And so I would test. And and you can tell whether you really do or not like a microscopic test,
Right.
but it's better than just saying, I feel weird.
Yeah.
And that way I was able to reassure myself that no, I didn't have a urinary tract infection, or yes, I did. Then I could do a clean catch, and then I could take that to a doctor. But in the meantime, I could take my antibiotic, but if I did the catch first.
Right, and that's something where you have it sounds like a good relationship with your doctor.
Right.
They know you, they've taught you, we've discussed, they know your history.
Right.
So that wouldn't be appropriate for everybody, but in your case, in your specific situation.
It was so helpful.
Yeah, and I didn't mention, but it is worth saying, we talked about the different parts of the urinary system, and if left untreated, then that infection can just continue to climb and rage and go right up those ureters. And what's at the top of those long tubes? We have the urethra, we have the bladder. Sometimes it's just contained to the bladder, but then you've got those long tubes, the ureters, then you've got those kidneys, right? So you could get a UTI anywhere in the urinary tract infection. What did we say the kidneys do?
Everything.
They filter. What do they filter? Urine from
Your food.
from your blood, right? Because the things that you eat, the oxygen, the food and nutrients that your body takes in, all ultimately goes through your blood, right? Because you've got your digestive system, and that's going to take things. Well, how does that nutrient get into your body? It goes through the blood. It gets down onto that cellular level. So if your kidneys filter blood to make urine, that's waste your body doesn't need, you're going to pee out, and you have an infection at your kidney level, what could happen?
Blood infection?
Yes.
Oh my God.
She said you could have a blood infection. So, and I don't say that to scare you. I say that these are very common. A lot of people get them. They think sometimes we can get a little lackadaisical about it and think no big deal, 3 days antibiotics, I'm all done. But you do have to know your body and be mindful that if you don't treat it, it could continue on. That infection's not going to just go away on its own. You're probably going to need antibiotics to cure that, and you want to prevent it from getting more serious. So it's just to be aware.
Lots of times you can have a backache,
Mm-hmm.
and that backache will, because I had pyelitis,
Yes.
so you think you're having problems, with your back,
Yeah.
but it's your kidney.
Yeah.
that you're
Yeah.
having.
It's a good point you bring up, because we do tend to do that. We're independent, fierce women, right? And nothing keeps us down, and we go to exercise, and then we think it's arthritis, or we can easily talk it away that, oh, I slept wrong, or it's my arthritis, or I did too much yoga, or whatever. And just be aware of your body. It goes back to what you said, when you really get to know what's normal for you, and then you'll know when something's not normal and when to get it addressed. But it's a good point. Yeah.
Have you ever heard of taking lemon water or drinking lemon water when you can't get a cranberry, or when you want to do something kind of prophylactically?
Some people do that just as in general. It's definitely not going to hurt. I don't know if there's any scientific evidence based for it, but
Neither.
it's
I
not
just
going to
wondered
hurt.
if you heard.
It may be.
Yeah.
It may be, because the urologist I go to, she said sometimes when your bladder gets too acidic, it can cause pain.
Yep.
And so she said stay away from alcohol, caffeine, chocolate,
Yeah.
and something else. I can't remember what there were
Soda.
4 things. So I thought, all the things I like.
Right.
It's always the one.
Yeah.
I know. He's a nurse.
Yeah.
And she has 6 kids.
You advise people to take pills? I know a lot of my friends have said, oh, the doctor gave me a pill to take.
A pill for what?
Well, so that you don't have incontinence.
Oh, so, and that goes back to, remember there's the different types of incontinence. So, know your body, and it's worth a conversation when you're having an issue, and it can be embarrassing to discuss. And people tend to try to not, sometimes people don't bring it up right away. But if you're having incontinence issues, remember what I said, it's not a normal process of aging. Now, as women that had children and our pelvic floor, yes, those can be normal parts of aging, but we can do something about that. Strengthening our pelvic floor muscles, doing those exercises. But if you're having an issue, it's important to have that discussion with your provider to find out the root cause of it and what type of incontinence it is. Because depending on the root cause, may change what our intervention would be. For some people, it is a medication and it is a pill. Maybe they have a neurogenic bladder, which has to do with the nerves, and in which case the doctor may prescribe something. But for some other people with different types of incontinence, that wouldn't really be that helpful, and it may cause other issues. So in some cases, that is a good treatment for people, but it goes back to knowing what the issue really is and what's causing it. That's why I say, regular elimination all around. If you can prevent constipation, you're not only doing your bowel good health, but you're also preventing problems with your bladder and your urinary tract. So, that can help. And then doing those pelvic floor exercises, when you're sitting down anytime, do them. So it depends, is the short answer to your question. Yes for some people, no for others. But the most important thing is knowing what's causing it. Some medication side effects can cause urge incontinence. They can actually cause that issue. So, and in which case, depending if a medication's causing those issues and you're continuing to have infection, your doctor may determine in conversation with you that the benefits of that medication are not they're not outweighing the risk of you having this infection. They may change it up. So have a conversation.
Well, it just seems funny that if it's not something to do with age, that it happens to all the elderly women.
But if you think about it, all of our muscles in our body can get weaker if we don't use them, right? Including our pelvic floor muscles. So that's part of it. The other thing is our bladders are probably irritated because most people don't drink enough.
Sorry about that.
No, that's okay. It's a nice little song. You like it?
I can't find my cell phone.
Oh no! So that means it might happen again. No, I understand what you're saying, but also, typically, once you get over the age of 60 or 65, you're also on more medication than you were in your earlier years, right? So there's a lot of contributing factors, but it's just like pain is not a normal process of aging, but so many people just assume that it is, well, I'm old, and my bones, my arthritis, and no, that's not acceptable. You are alive, and you have life to live and things to do, and you don't have to be in pain, or we can at least manage it. I feel that, the same way about urinary health. There's plenty of things we can do. Now, that's not accounting for someone who has anatomical issues. Like I said, remember I talked about having different eye color and height and weight and everything else. Just like we look differently on the outside, we could look differently on the inside. And there could be something like, who knows, somebody's ureter might be like kinked a little, or the kidney might be torqued a little bit. I mean, that's real, that could happen, and that could make somebody more at risk. So, and then I think dexterity with some people, and what I mean by that is how easily can you actually, perform your hygiene effectively as you used to too, right? Is it hard for you to reach? What's your toilet set up? Do you have something to hold on to? Your stamina? Some people lose their, their clearer vision, or like they're not as able to reach and do it as effectively, or they're avoiding going to the bathroom because it's so far away, and then you're ending up holding on to it, making you more at risk for developing.
If you can.
If you can. If you can, right.
I've read about treatments using Botox. Do you know anything about that?
I don't know much about it, but I have heard about that as well. Yeah.
Doesn't she know where you